So the idea of what we are going to do here in this port brain surgery simulator models, okay? The English is okay?
Yes.
Yeah? Perfect. So the idea here is to have a very nice instrument and technique to develop, to treat patients with deep-seated lesions, whether it's an hematoma, a brain tumor, paraventricular, intraventricular, deep-seated, supratentorial, infratentorial, all kinds of tumor, abscess, hematoma, etc. So what we use is the parafascicular approach. We have different parafascicular approaches, anterior, medial, posterior, and the parafascicular approach aim to dissect the fibers instead of disrupting them, okay? When we, on a contemporary basis, we care for the superficial landmarks. In this scenario, we also take advantage and take in mind the deep-seated networks, all the neural network, the subdural neural network. And these have become very important because of the all the new developed to maintain functionality for the patients, okay? So this is the ports. You have different brands, etc. With the one I use is the Vicor VBAS, and they have different size in wide and length. And what I do is dissect the sulcus, okay? Introduce first the port using neuronavigation. So let's suppose this is our neuronavigational probe. Introduce the port in the first time, seeing the neuronavigation, okay, to the target, then take it out, then introduce the next one in diameter, the 12 millimeters of the Vicor, to the target. We see we are in the target, then take it out, and then make the final introduction of our working channel retractor to the target, take out this part. Now we are in the tumor. And using this is, can you, yes. So now using the endoscopic, exoscopic or microscopic view, we can see we have a little bit of parenchyma down there, okay? But we see there we have our lesion, right? This is a bleeding tumor. So we approach, we can see the hematoma over there and see how they dissect all the fibers. Now we are seeing the hematoma. We make a little bit space out of ourselves. We start aspirating the hematoma.